today's episode, we explore why our vision gets blurry as we age. From the causes of cataract to the prevention tips, join us as we uncover the fact with Dr. Dilytutu Gogoi, Assistant Professor at BA Sangma International Medical College and Hospital, Meghalaya. Stay tuned for expert insight that could help you or your loved ones maintain clear vision for life. Hello and welcome back to another episode of USTM Podcast. I'm your host Fetisha Syemiong. In today's episode, we'll be diving into an important health topic that affects many people as they age. That is cataract. Why does our eyes get cloudy as we age? How does it affect our daily life? What are its prevention and its treatment available? And in today's episode, we have with us Dr. Dilytutu Gogoi, Assistant Professor at BA Sangma International Medical College and Hospital, Meghalaya. Welcome, Dr. Gogoi. It's a pleasure to have you here.
Thank you, Fetisha.
Dr. Gogoi, to begin with, let us understand what exactly cataract is and how does it affect our vision.
Okay, to explain cataract in medical terms, cataract is actually the pacification of the crystalline lens. Now, to explain in the common language for the common people, actually our eye has many different structures from anterior to posterior. So, and the crystalline lens is one important part of the eye that helps in vision. So, when this part of the lens become opacified or cloudiness, then it is known as cataract.
Dr. Gogoi, as you have mentioned that cataract affect many aged people. So why does it affect aged people and what changes in our eyes as we age?
Actually, cataract, the most common cause of cataract is the senile, that is the age-related cataract. So usually after the age of 50 to 60 years, almost most of the people will get cataract, either starting earlier in one eye than the other or bilateral cataracts. So this is one of the most common cause, but there are also other causes when cataract gets developed.
Doctor, since cataract are often discussed in rural context, so why is cataract common in rural areas?
Actually, this question, if I have to say, it is not common in only rural areas. Cataract is common both in the rural and both in the urban areas also, and it is a disease of everyone. It is not that it is common in the rural areas. But what happens? The rural people, they are unaware, they are ignorant of the cataract disease, and so they suffer more, and that is why the screening and the awareness of this disease is very important in the rural people.
What are the common symptoms one should look out in order to understand that they have developed cataract?
In cataract, the most common cause is the diminution of vision. There will be decreased vision. The patient will be complaining of decreased vision. But there can also be some other symptoms like one can face rainbow-like light when they see, and they can also get glare when in darkness, or when they drive the cars, the reflections of the light might come up. So these are other symptoms, but the most common cause is the decreased vision. That is the diminution of vision in cataract you will get.
Dr. Gogoi, since we are often exposed to sun, so can our lifestyle or extend exposure to sun, can it influence the development of cataract?
Yeah, actually, they play a minor role if we have a good diet, like diet rich in antioxidants and vitamins, riboflavin, vitamin B, and also if yes, UV rays do play a role, but then they are not directly related. If regarding the age-related cataract, so that happens with age. So at one point of time, you will get the cataract. So they just play a minor role. But yes, if you are taking a good diet, if you are protecting your eyes from the harmful rays, then it will give a little benefit.
Thank you so much, doctor, for giving us this insight on how do we prevent cataract. So as we have discussed how can we prevent cataract, so now let us discuss what are the options available when one has been diagnosed with cataract.
The sole and ultimate, actually, the treatment of cataract is the surgery. So you have to go for the cataract surgery. If the intervention is taken in the right time, then we can bring back the vision loss that comes due to the cataract. So early and the right time detection and right time intervention of cataract can give back the vision. So it is a treatable disease. Cataract is a treatable disease. So, and its ultimate treatment is surgery.
Dr. Gogoi, as you have discussed that the treatment available for cataract is surgery. So as when we hear surgery, many of us fear surgery. So can you tell us how safe cataract surgery is and what are the after recovery process?
I will say you that people should not fear for cataract surgery because cataract surgery is the most popularly and the most commonly performed surgery. So one should not be afraid of cataract surgery because cataract surgery is not like other surgeries. Even now with advanced technologies, surgeries have come up that you can come to the hospital, you can get your cataract surgery done, and after 2 to 3 hours you will get discharged too. You don't need to stay in the hospital also. So the recovery process is also quick in different types of surgeries. And if we do go for the manual surgeries like manual small incision cataract surgery, it will take about 1 month. And if you go further advanced like phacoemulsification, it will take about 2 weeks. And further more higher technologies have come up like the femtosecond laser surgery, so that takes even lesser time. So recovery process is also quicker, and so one should not be afraid of cataract surgery. It is widely done surgery, and it takes quick time for recovery also, and so one should not be afraid of it.
Thank you so much, doctor, for giving us this insight on how do we prevent cataract. So as we have discussed how can we prevent cataract, so now let us discuss what are the options available when one has been diagnosed with cataract.
The sole and ultimate actually the treatment of cataract is the surgery. So you have to go for the cataract surgery. If the intervention is taken in the right time, then we can bring back the vision loss that comes due to the cataract. So early and the right time detection and right time intervention of cataract can give back the vision. So it is a treatable disease. Cataract is a treatable disease. So and its ultimate treatment is surgery.
Dr. Gogoi, as you have discussed that the treatment available for cataract is surgery. So as when we hear surgery, many of us fear surgery. So can you tell us how safe cataract surgery is and what are the after recovery process?
I will say you that people should not fear for cataract surgery because cataract surgery is the most popularly and the most commonly performed surgery. So one should not be afraid of cataract surgery because cataract surgery is not like other surgeries. Even now with advanced technologies, surgeries have come up that you can come to the hospital, you can get your cataract surgery done, and after 2 to 3 hours you will get discharged too. You don't need to stay in the hospital also. So the recovery process is also quick in different types of surgeries. And if we do go for the manual surgeries like manual small incision cataract surgery, it will take about 1 month. And if you go further advanced like phacoemulsification, it will take about 2 weeks. And further more higher technologies have come up like the femtosecond laser surgery, so that takes even lesser time. So recovery process is also quicker, and so one should not be afraid of cataract surgery. It is widely done surgery, and it takes quick time for recovery also, and so one should not be afraid of it.
As in relation to various diseases, there are various myths and misconceptions. So Dr. Gogoi, have you ever come across any myth or misconception regarding cataract from your patient?
Yes, exactly. I would say that I don't really remember the myths and misconceptions, but the main thing is that people are ignorant. They stay with the cataract, they live with the cataract, and they become blind with the cataract, and they don't get their eyes checked, and they stay with the cataract. But cataract is such a disease that it can be treated. Once we do the surgery and put an artificial intraocular lens, immediately the patient will get back the vision. But the cataract surgery have to be done on time because if we don't do it on time, if we wait till the cataract matures and become very hard, then at that time it can become complicated. And that is why the importance of knowing the cataract, their own eye problem, is important.
Dr. Gogoi, let us discuss the importance of early detection for cataract and also how often people should go for eye checkup as their age.
Early detection is very important, as I have said, because there are different grades of cataract, grade 1, 2, 3, 4, 5, up to 5 grades there are cataract, and we as doctors usually advise cataract surgery when they are about more than 2 and about 3 stage. But one should not go for the last stage of the cataract maturation because at that stage sometimes what happens in total cataracts and mature cataracts and hard cataracts, at that time when we go for surgery there might arise some complications. And sometimes also what happens, some people wait till the cataract becomes so hard that their eye pressure becomes increased, and at that time if we go for surgery, that is lens-induced glaucoma we say, where the eye pressure increases because of the cataract, at that time when we go for surgery there is chance that sometimes the vision don't come back. On the other hand, cataract is such a disease that when we treat on time, we get the vision back immediately. So the cataracts treatment has to be taken on time, and people should be aware of the disease.
So Dr. Gogoi, as we have discussed regarding the surgery of cataract, so can cataract come back after surgery?
Cataract never come back after surgery. Actually, what happens when we place an intraocular lens, we place in the bag only some posterior capsule, that is known as a posterior capsule of the normal lens, that we keep behind, and on top of that we give the artificial intraocular lens. So cataract never comes, but sometimes what happens, this capsule that was left behind, sometimes there might be some ossification, which is known as the posterior capsular opacification. So when this happens, there is a minute procedure in laser. We do a procedure, and with the help of that, again the patient will be able to see. So according to your question, cataracts never come back.
Dr. Gogoi, what advice would you like to give to families having elderly members, and if those elderly members are showing signs of cataract?
Yeah, if I have to give the advice, so everyone should actually, not only people having the elderly people in their home, but after the age of 40 years, usually the age-related conditions like cataract, like glaucoma also, where the eye pressure increases, all those diseases come up. So after 40 years, actually everyone should do a screening of their eyes. A comprehensive eye checkup is always advisable. And more, in addition, where there are elderly people, so you should get a yearly eye checkup for knowing the conditions.
Thank you so much, Dr. Gogoi, for giving advice to the elderly person in the family. I hope that the viewers would apply this advice that you have given. So, Dr. Gogoi, is there any advancement in the treatment of cataract or any technology which would you like to highlight?
Yeah, there are many recent advances in cataract surgery. Cataract surgery has started a long back, and till now there are many recent advances going up in the surgery also. So all the surgeries are still going on also, starting from the manual small incision cataract surgery to phacoemulsification to femtosecond laser cataract surgery. So there are a huge amount of advancements coming up, and it has been widely performed.
Dr. Gogoi, before we wrap up this session, do you have any message to our viewers regarding eye health and cataract?
Yeah, at the last, I would just like to say that everyone should get their eyes checked. A comprehensive eye examination is always very important. I always give emphasis on this point, that a comprehensive eye checkup should be done, not just the eye power. It is just the starting to see the vision and the eye power, the refraction, but as a whole, we need to check our cataract status, our glaucoma screening, and also the retina screening. So as a whole, we should make a yearly checkup. As I have said, that from the age of 40, you should do a screening for all the diseases of the eye, and then you can go a regular annual checkup if everything is normal.
Thank you very much, Dr. Gogoi, for giving us a valuable insight on cataract and eye health. It was very enlightening to learn regarding the symptoms, prevention, and treatment for a very common yet overlooked condition.
Thank you, Fetisha. It was very nice interacting with you.
Thank you so much, viewers, for turning into USTM Podcast. Remember, regular eye checkup and healthy lifestyle can make a huge difference in protecting your eye vision as you age. Stay connected with USTM Podcast for more health insight and expert discussion. Until next time, stay safe, take care, and keep your vision clear.